Today's session, as you just heard. Good afternoon, everyone. Thank you so much for joining us here today. My name is Tina Corpus, and I'm the Executive Director of the Permanent Commission on the Status of Women in Connecticut. We're so pleased you joined us for this topic entitled COVID-19 and Childcare in Connecticut. Is it time for structural change? We are thrilled to have with us today two persons who have perhaps had the greatest impact in this area for Connecticut's women and families and continue to do significant work each day. Commissioner Beth Bye from the Office of Early Childhood and Commissioner Vanessa Dorantes of the Department of Children and Families. Commissioners, thank you so much for joining us for this important conversation. We're honored to have you. The impetus for this conversation was the statewide research conducted by the PCSW. The PCSW was founded as a state agency in 1973 and for 47 years engaged in research, advocacy, and landmark legislation on behalf of Connecticut's women and girls. In 2016, the PCSW was reincorporated into two nonprofit corporations from which we conduct our work today. We are a bipartisan organization with a nonpartisan mandate. Last spring, with the data beginning to come in on the national level about the child care system in crisis and women being laid off or leaving the workforce in record numbers, the recession was nicknamed the She Session because of the disparate impact it had on women. The PCSW saw an opportunity to do what we have always done, and that is to provide primary research on Connecticut's women. Today, we will focus specifically on our findings related to childcare, early education, and working women with dependent children. We presently find ourselves in an intermediate stage of the pandemic, out of the winter surge, with cases decreasing and restrictions lifting. Therefore, we will focus today on looking forward. That is, in our discussion with Commissioners Bye and Dorantes, we hope to focus on the important work they are doing in these areas now, and how COVID not only created a crisis, but where they see opportunities for lasting change. Before we plunge in, I have two sets of thank yous. Thank you to Shanae Russell and Diane Fasano in the Commissioner's offices. Your offices run like clockwork, and it is always a pleasure to work with you. Thank you also to the PCSW staff, Max Grossman, Carolyn Kiernan, and Sarah Delahunty, who made this research and report possible through all their hard work. PCSW's research contained two parts. The first was a 30-question survey, which was distributed through a multitude of channels statewide, including Connecticut legislatures, government commissioners, through town halls, via email, and social media. Our survey questions focused on 5 areas of inquiry, which you can see listed on this slide. The survey was available electronically and in hard copy in English and Spanish. It was taken by 1,020 respondents representing 147 zip codes across the state. We held 10 focus groups across Connecticut, which were open to the public. Our focus groups, attended by over 100 women, allowed women to tell their stories, many of which quotations you can see in our report. We analyzed the survey respondent pool against 4 diversity metrics: race, household income, age, and geography, in order to ascertain whether our data pool was truly representative of Connecticut's women. Quick question, technical question. Is the gallery view that I see blocking everyone's ability to see the slides? No, okay, thank you. This slide shows that the racial and ethnic makeup of the state of Connecticut overall was mirrored in our survey respondent pool. Similarly, we examined our data across household income lines, geographic lines, and age. Again, we were comfortable that the women in the survey pool mirrored that of Connecticut against these 3 important measures. I should state that importantly, with respect to geography, as evidenced by the map in the slide, 75 of our participants were from the 3 more heavily urban counties of Fairfield, Hartford, and New Haven. 75% of our participants were in these counties, and 75% of the state's population resides therein. The data was collected over a 5-month period between October 5th, 2020 and February 5th, 2021. The red bar charts at the bottom show how many survey responses were submitted in each of these months. The charts on the right show the context in which Connecticut's women were living during this period of time across several important indicators, including rising COVID cases, rising COVID deaths, and unemployment, housing insecurity, and food scarcity metrics. As you can see, the winter surge was captured in our data. We felt it was important that the economic shocks, both of that period and in the 9 months preceding it, were captured. Now for the data we collected. Let us start with employment. Of the working women in our survey, 26.5% were either furloughed or lost their jobs due to COVID. Our findings in this category had variability across racial and ethnic lines. White and Asian women lost their jobs or were furloughed less frequently than the pool average. However, women of 2 or more races and Latino women fared worse at 47.4% and 37.9% respectively. There was also variability when viewed across household income lines. As the bar chart here shows, for women below the federal poverty line for Connecticut, approximately $35,000, they both lost jobs and were furloughed more frequently than the pool average, more frequently than the higher income levels, except for, as you see here, the tall bar, the $56,000 to $75,000 range. The PCSW asked survey respondents whether their total monthly income from all sources had increased, decreased, or stayed the same during COVID. This refers to their pay from work, pension, investment income, spousal benefits, and other categories. As the chart indicates, total household income decreased for 33% of our survey respondents. As you can see, the median decrease in the pool was between $500 to $750 per month. For some of our respondents, their total income increased during COVID. But as you can see, even where there was an increase, the average increase was smaller than the average decrease. The median decrease in total monthly income of $500 to $750 per month equates to approximately $6,000 to $9,000 per year, with a median household income of $75,000 a year, both in the state and in our pool. This equates to approximately 10% of household income. Income loss was felt differently across race and ethnicity. As you can see from the middle box here, Latinx and women of 2 or more races fared worse than the pool average. A third key theme of this section was the impact of COVID on women's ability to work or return to work. It will come as no surprise to anyone that 68.2% of all women in the respondent pool reported this impairment. The largest driver of this impairment was a change to their work situations, meaning their hours changed, they lost their jobs, etc. Factors 2, 3, 4, and 5 driving this issue across the entire pool were the categories of childcare, children at home, homeschool demand, and other home work. We will explore this further in a minute. The effect of increased home demands on women's ability to work was a theme in virtually all of our forums and a top 3 concern in most of those. Women describe making the decision to leave the workforce, deciding as a family to downshift their careers as theirs was the lower income job within the couple, and the difficult decision between supporting their children's education or continuing to work. Of the women who reported that their work situation had been impacted, 16.1% of our respondents reported that their ability to advance in their careers and be promoted had been impacted. This number indicates a more far-reaching and long-term effect even after the pandemic, including dropping out of the workforce, downshifting, changing in job, and the prospects for recovering prior income tenure and potential. Particularly impacted, as you can see from this chart on the bottom left, was the 25 to 45-year-old age group, with approximately 28% of them reporting this setback. Approximately 70% of those in this age group had dependent children under 18 in their homes. So they are not only at a stage in their careers where they are building their credentials and seniority, and a setback can be most impactful, but they're also disproportionately likely not only to have dependent children, but to have young dependent children in their homes. In addition, women at the 3 highest income levels, as you see here on the bottom right, reported higher levels of long-term career impact than the pool average. No single factor showed more uniformity across racial, household income, age, and geographic categories, as did the reporting of the mental health impact of COVID on Connecticut's women. This scatter plot takes every age, geographic, race, and household income category and plots it in a single place. As you can see by a clustering of all these shapes in the top half of the graph, there is not a single one of these categories which dropped below a 28.5% of that category reporting a mental health impact. In 5 of our 6 countywide forums, mental health impairment was cited as a top 3 concern. Participants expressed guilt over reduced productivity at work, difficulty juggling professional and family life, isolation and lack of outlets, stress over compromised college and job prospects, particularly among college students in our private forums, the combined effect of COVID-19 with the Black Lives Matter movement, other societal disruptions of 2020, and finally, anxiety and fear due to the constantly changing circumstances and grieving the loss of loved ones. We asked survey respondents whether they or someone they knew was in a domestic violence situation, and 14.5% answered yes. We further explored what the impact of COVID had been on those situations. The pie chart here on the left takes those women who reported domestic violence situations and divides them into those for which a pre-existing situation worsened, those for which the situation began since COVID began, and those for whom the situation stayed the same or improved. The clear pie slices are those represent 49.8% of this population for whom the situation either started or got worse during COVID. Our data further confirmed what domestic violence advocates have often cited, and that is that domestic violence is a problem that spans socioeconomic levels. As you can see from the chart on the lower right, the red bars represent domestic violence situations by income category. The gray and black show those situations for which COVID worsened or created. And that's a little bit too causal, for which the situation either started or got worse during COVID. As you can see, there is no correlation with household income level, other than the fact that in the highest income category, each 3 of those negative metrics was the highest. Finally, in education, 68.5% of respondents who were themselves or had a student in their house indicated that their educational progress had been negatively impacted by COVID. When we got behind the drivers of those situations, lack of ability to pay tuition and lack of ability to access their education virtually were the top 2 drivers. Negative educational impact by age showed pronounced disparities across the pool. The categories of 18 to 25-year-olds and 35 to 55-year-olds experienced the highest percentages of negative impact. As one would expect, 44.9% of those in the 18 to 25-year-old category were themselves students, which means they were in late high school or college. And 79% and 63% of those in the categories of 35 to 45 and 45 to 55 had school-age children in their homes. Again, not only were these groups affected disproportionately relative to the pool as a whole, but even among those affected, those categories ranked the highest. Women in lower income households, as you see in the bottom right, disproportionately reported that they were unable to access their education virtually and less able to continue to pay tuition. Those are the findings for the PCSW's research as a whole on these particular topics. We encourage those who work in this area or are interested to read the PCSW report in full for a full exploration of our findings. If we had to leave everyone here with one of the key takeaways among the tens of thousands of pieces of data that we collected, it would be the significant impact of COVID-19 on the working lives of women with dependent children. Specifically, their increased challenges in meeting the demands of home and work, the impact of COVID on their own childcare structures, and the impact of the pandemic on their long-term career prospects. We would therefore like to conclude the section of our data discovery with comparisons of those women in particular. So this slide compares women with dependent children, that is, those who answer that question by checking 1, 2, 3, 4, or 5 plus dependent children, compares those women to our total pool. It further compares those women with dependent children who checked that they were working full-time or part-time, and those who identify themselves as single mothers. These pools were similar in some ways and differed in other ways, as you see. Roughly half the women with dependent children, that's these 47s here, fell into the 35 to 55-year-old age category. By contrast, though it's not here on the slide, 131 out of our 161 single mothers fell between the ages of 18 to 25. Median household income of the pool relative to women with dependent children was consistent, as you can see, except for single mothers whose median household income was between $25,000 and $35,000. Finally, women with dependent children, as you can see here, were slightly more likely to be working than the pool average. With respect to their employment and the impact of COVID, the results were heterogeneous across these categories of women. Decreases in income due to COVID, impairment of ability to work, and impairment of long-term career prospects fell on women with dependent children, working and overall more than on the pool as a whole. As you can see, working women fared the worst in terms of their ability to work unimpaired, with 82.6% reporting an impairment due to COVID. Working mothers were also more likely to lose income and suffer setbacks in their long-term career prospects. Only single women, that is this 37.1%, only single women showed a higher propensity to have lost $25 to $500 a month in income. And this could be owing to the fact that women who were single mothers were concentrated in the lower income levels. In the area of domestic violence, we explored whether domestic violence situations of our survey respondents as a whole differed for women with dependent children. The rates of those who reported domestic violence situations were roughly equivalent. That's the top row here. However, the impact of COVID on those situations was elevated for those women who had dependent children in the home. As you can see from this chart, while 49.8% of the pool reported a worsening of the domestic violence situation, 58.3% of working women with dependent children reported such an impact. In the final 3 questions of our survey, we asked the respondents to identify the 3 greatest threats to their economic security overall, both before COVID and due to COVID-19. For women with dependent children, the threats that ranked the highest, threats to their economic security, were lack of childcare, family responsibilities, and unable to work. Also notable among women with dependent children was the increase in the percentage of women reporting those threats at the time of response, that is after COVID. For working women with dependent children, again, lack of childcare and family responsibilities were both numbers 1 and 2 before COVID and jumped significantly as a result of COVID, or at the time of response, I should say. These factors ranked higher as threats to economic security than these other factors that you can see, including lack of job security or no job. Finally, the last question of our survey asked women an open-ended question. They were asked to identify the single factor that would most support their economic recovery from COVID-19. There were no answer choices, only a blank box where women could furnish their own response. The single most cited factor at 29.6% of the entire survey pool was the need for support in balancing work and childcare responsibilities. This outranked the second most highly cited request, which was federal and state relief. That concludes our presentation of our research findings. We believe that the data supports strongly the work that is being done at OEC and DCF today, as well as the case for future prioritization of this work. Commissioners Bye and Dorantes, we would love to spend the rest of our time together really hearing from you. If you would, we would love to hear an overview of the work that you're doing in your department specifically related to COVID recovery and how you see that work projecting over the medium to long term. Commissioner Bye, maybe we should start with you.
Tina, I'm so grateful for the work on this. I think it really exposes some challenges that were there before COVID, but that COVID shone a light on, and it couldn't have done that without the work of the PCSW. So thank you for that. And Commissioner Dorantes and I have been working collaboratively since we started, but certainly in COVID even more, because we know, and Commissioner Dorantes, and I'm sure she'll talk to you about it, talks a lot about the impacts of poverty on the family and on child welfare interventions that are not necessarily in the interest of families. We'd rather, Vanessa always says she's trying to put herself out of a job. We want to get this right and give parents the supports they need. But it's sort of like COVID pulled the rug out from under parents in many ways. So they didn't have the supports they needed while many supports were stood up. But I can talk about what's been going on in our agency, and I would say it's really been a collaborative effort. We have had incredible advocates in the early childhood field for decades talking about what needed to be in place that was missing. And during COVID, we had regular feedback from the field. We also had support from commissioners around the country who were sharing, how they were addressing this. So I think our team at OEC did a super job, but it was with a lot of structural support, which is, you were just talking about how families lost a lot of those supports. They lost money. They were in more difficult relationships, and then lost jobs that for some of them are the structure and routine that supported their well-being, never mind the money. I mean, jobs are more than just the money. The money is important, but jobs give us a purpose to our day, and they create structure and routine for families. And we saw young children in families that suddenly lost that. And families were trying to educate older children, take care of their younger children. We all heard from our family and friends just how difficult this was. And if you add worrying about keeping your apartment, feeding your children, all of those items. So what we've been doing in the Office of Early Childhood, I think broadly, is trying to support the child care infrastructure. It was estimated that Connecticut could lose up to 40,000 spaces during the height of the pandemic. And while we did lose some programs, it did not amount to that because we were able to really get funds out because of the federal government. This has all been really in partnership with the federal government. We received $23 million in December of 2020. That was, well, even before that, in September of 2020. That was really helpful for us to get grants out to programs, but also to help families with childcare costs so that they could afford, and to support frontline workers with programs and childcare help, and make sure childcare programs were there to support those first responders. There was so much fear at the beginning. It's easy to think now. We always knew that with masks and hand washing, that and cohorting, that people could be safe. But at the beginning, childcare workers were out there supporting nurses and EMTs and doctors and providing childcare so they could go take care of people who were sick. And so we really had to put incentives out there to keep childcare available, because 3/4 of programs closed and about 1/3 of family childcare homes closed. So our approach has been support the providers, support families as we can, And we had to stick to a lot of complicated federal rules, which I won't get into here, but that limited some of those supports to living within the rules of helping families who met certain income thresholds, in many cases leaving those families who, again, in terms of putting a spotlight, it's always been super difficult for families like between 50 and 75% of the state median income to afford childcare. And this made it super hard. I think the things that the second tranche of money, the 74 million, and then the 276 million that's come in since February, has made the biggest difference, where we've been able to open up significant grants to programs. While we gave them grants at the beginning to help programs stay open, most of the programs, it was not enough. And a survey of the field showed that 50% of child care providers put business expenses on their personal credit card or on their personal accounts to stay open. So the grants were helping, but it still wasn't enough. Yesterday, we opened $120 million in funding to all licensed child care programs in the state to help pay off some of those debts they incurred, because much like the airlines, the parents didn't come, they didn't have the revenue coming in, they were trying to pay their staff, they were trying to get the PPP loans, couldn't do that. But that was a significant investment by Governor Lamont to get $120 million to all licensed programs, both family, child care, and centers. The other thing I think that's going to make a huge difference for looking at your data is the governor put aside $50 million to be used for child care for people in workforce development. He felt like a lot of people, their job went away, and we do have open jobs in Connecticut, so there's a need to retrain, but we've always been one of the most punitive states when it comes to how can you qualify for child care help, and have never, in my time as an advocate, allowed workforce childcare unless you were in TANF. So this opens up to thousands of families the opportunity to access childcare while they are doing workforce development. So this should really help women. And also bump that income threshold from 50% of SMI to 60% of the state median income. We're hoping to get to 65% of the state median income for families, but some federal rules changed that, and I'm happy to talk about that if people have questions. But that opens up another $26 million. And then the governor there wasn't enough money to increase rates across the board, but he and Secretary McCall were clear, we will pay more for high quality care. So he invested another $26 million into rates for accredited programs. And that's something that will keep going after the American Rescue Plan funds go away to invest in quality. So I think our big goal is to make sure there's equitable access to childcare, and that's sort of a driving principle. And also whatever we can do to support optimal child development is super important to us. And we know that children do as well as families do. So it's grounded in families. So I'll stop there, and I'm sure you have specific questions, but our goal was making sure we had the infrastructure after the pandemic started to wane, and we had programs that were available, that they didn't lose all their staff, and that families had help paying for childcare.
Thank you.
Mm-hmm.
Commissioner Dorantes, if you would like to give an overview of what's happening today at DCF, that would be wonderful. And then maybe we can start with our discussion part.
I'd love to. Tina, thank you so much for having us. And as my partner in government, Commissioner Bye, indicated, that I feel like we've been joined at the hip. Right from the beginning of the Lamont administration, there was the expectation of us, working together, but we had no idea of, of course, what was on the horizon for all of us. And I think our bond with each other and our collaboration between systems has only gotten stronger throughout the pandemic, because we've never stopped. There has just been an ongoing support of not only the systems, but of the outcomes associated with that, because as indicated, there was this responsibility to continue to meet the needs of our constituents, But like the workforce that Commissioner Bye is talking about, over 78% of my workforce are female as well. So, as I was planning, I had to think about the impact to keeping the children and families that are represented on our caseload safe, but also quell the transmission rates across my staff. So I think as DCF approached really understanding how we were going to navigate the workforce, the first thing we had to do was stand up a structure that was similar to the Governor's Unified Command, and that would be my opportunity to know at a moment's notice what was happening across the department. So I held regular meetings with all of the leaders of DCF. In the beginning, it was daily, and then it went to a couple times a week, and now we have our internal unified command weekly. And that was an opportunity not just for me to have on-demand information about what was happening across the department, but for the divisions within DCF to talk with each other and to understand how they could help each other navigate this new world that we were all thrust into. I appreciate the survey that the PCSW has conducted and the deliberate attention to what we've been calling the imperfect storm of COVID-19, racial unrest, and economic devastation. The focus on the impact to women, I think, is also extremely important to the Department of Children and Families. Along with Commissioner Bye and Commissioner Delphine-Rittman, you know that we also chair the Women and Girls Council Health and Safety Subcommittee. And so many of the issues that have been highlighted and illuminated in the survey are things that our subcommittee have identified as real salient issues that have been impacting women for a long time. The pandemic has, of course, laid bare some of those things that have risen to kind of prominence over the last 14 to 15 months. And, as you think about the role of child protection and all of that, we have to determine and really get clear on the definition of what child maltreatment actually is. The one thing that the pandemic allowed us to do was to peel back the layers of our data. So in Connecticut, just like other jurisdictions across the country, there was a considerable drop in the number of reports that we got to our child abuse hotline. And so immediately the cry came out across the country of, oh my goodness, children are not going to school, therefore we don't know what's happening to them. And so there was this almost immediate precursor that children at home with their families were being harmed. And we decided right from the beginning that, the approach to keeping children safe is to support their families and to build up parental capacity in their parents. And that, for the most part, what we've learned is that children and families are super resilient when given the resources to be able to meet those basic needs. And we were able to look at our data over the pandemic and recognize that although 40% of our typical reports come from schools, less than 8% are substantiated for abuse or neglect. So that tells us there's a wide swath of reports that are made to the Child Protective Service Agency that, I said less than 8%, less than 5% of reports that come from school personnel are actually substantiated for abuse or neglect. So that tells us that as we peel back the layers, how do we work with our education partners to help them understand when there is an issue that results in Child Protective Service intervention as opposed to child welfare or child well-being prevention systems. Because, in the, understanding what children and families need, along with that internal unified command structure, DCF also stood up a COVID-19 mailbox where over 27,000 unique individuals contacted the department to access information on childcare, housing, food insecurity, activities related to child and family well-being. If you go to the DCF website, you can find those tabs. And we're able to track when people kind of log into the website to gather information. And that was people coming to us unsolicited from across the state to just get information. So that helped us start to organize what it was that we needed to make sure in the children and families on our open caseloads, what they needed, what our foster parents needed. We've conducted 2 foster parent studies to be able to make sure that they had what they needed when school shuttered. We also recognize that in the context of this imperfect storm that we were all also in, that the important responsibility that we have to ensure children's safety could not be compromised. And so although we shifted to a considerable amount of our workforce conducting their work remotely, there was still a triage process at every single area office that determined whether or not a safety or a risk factor prompted an in-person response. And so our child in placement number stands today at 37,093 in terms of how many children we have in care. And, you know, if there was a concern about whether or not the department was able to continue its mandate, we continue to reunify children. We continue to remove children and place them in foster care. We continue to reinforce families, and we continue to work with our court partners when we could to do remote hearings. The other thing that I think is important to note is that there was a federal moratorium on children who would be leaving foster care because of their age. And I've resisted the term aging out of care, because I think as we learn more about the needs of older youth in care, and I see some of our friends from Voices in attendance today, that the attention to children and older youth in care is about preparing them to age into life. And so over COVID, we had to pay attention to what was happening to our older youth in care to make sure they had what they needed educationally and from a social emotional standpoint, and also from a vocational standpoint, because just like we were talking about the survey results and women who lost their jobs, there were significant number of children and older teens in care who also couldn't keep their jobs because of the impact of the pandemic. The last thing I'll say before we shift over to kind of a question answer format is the other bigger piece that DCF had to pay attention to during this time is that we are not only the Child Protective Service Agency, but we are also responsible for children's mental health in Connecticut, or children's behavioral health. And what we know is that there is a seasonality to children's mental health needs, and really recognizing that the springtime often brings a higher rate of children going to the emergency departments across the state. And what we've seen is a significant backup of children in need of inpatient hospital stays. So we've had to work across departments, inside and outside of state government, to really try to address the throughputs of the children's behavioral health system. And it's really exciting for me to see how Governor Lamont has continued to think about behavioral health across the lifespan, beginning with infant and child mental health, all the way through to the work that DEMIS does, and really trying to highlight those areas that create a more fluid system as it relates to children's behavioral health. So as the department thinks about the recovery from the pandemic, we work really closely with our private nonprofit providers to make sure that they were stable. I met with many of their trade associations very regularly throughout the process of the pandemic to see what it was that could be still conducted in a virtual format, and to make sure that those providers were viable on the other side, because they are going to be the workforce to kind of help make sure that children and their families recover. So I think for me, really making sure that equity is at the heart of all the decisions that we make, understanding the definition of neglect that often masquerades as poverty, and then the impact of specifically what this pandemic has meant to particular groups of people, particularly parents of children, and women we know make up a huge majority of what that looks like in our society. So we're happy to be a part of this conversation today, and hopefully that gave you a bit of a bird's eye view of what DCF has been experiencing over the last year or so.
Very much so. Thank you, Commissioner. I just wanted to ask one more specific question of the commissioners before asking to take questions from the floor. This intermediate period that we're in, where there's still federal funding, particularly in the Office of Early Childhood, and gives us an opportunity to pilot things or expand programs that you both have seen a need for. What can you address what can we take away from this period? And if we find things that are working better than the system worked before COVID, how can we plan now to address in 2 years a shortfall of funding that may occur when the relief plan is over, really?
Yeah, I'll jump in really quickly and then I'll pass the baton to Beth on this one, because it's really important that we heard that from Governor Lamont, that they were bold, things that we were putting forward. We were kind of trying to resist the term initiatives, because as you've indicated, you don't want to just start things for the sake of a new coat of paint without recognizing the sustainability of what would happen beyond the funding availability, because that's almost a setup. You know, it's particularly for families and communities as they look to recover. There are going to be some things that might have a one-time cost or a short certain time period as a bridge to get us to that kind of better Connecticut than we were before the pandemic. But I think that it was important for us to be very clear and intentional about any of the recommendations that we made that had sustainability. So as I referenced a lot of the children's behavioral health throughputs and the recommendations related to ARPA, many of those came from the existing children's behavioral health plan. So they were things that were already either underway or in concept and development that we suggested or recommended that some of the funding be recommended for, so we could scale them up or really do a proof of concept to determine whether or not it's something we would like to, include in our budget beyond the funding streams that are available to us. So like Commissioner Bye was talking about, the federal funds that are coming into the state are coming in so many different pockets, from the mental health block grants to the funds that are going through URSA and the education department and municipalities. And we want to be smart about how we partner across state government, but also with our cities and towns, and to maximize these funds to make sure that there is sustainability beyond the next 2 years.
Thank you. Commissioner Bye?
It's a really great question, because we can't lose this opportunity. I think that one thing we're really testing out is what happens when we give parents childcare for workforce development. What happens to their income? What happens to what they pay in taxes? What happens to families and what they need if a parent has access to that. It's something we've been wanting to try. We've actually been piloting it both with some adult ed and with CSCU. And what we see without enough data yet is that we have more women, for example, sign up for a manufacturing technology program when it's paired with childcare. We know that's a higher paid field. So, working with our partners at the workforce boards and Department of Labor, we can see what happens now when parents have funding for workforce development. Because even though that's a $50 million limit, if we see big impacts that bring in or save money other ways, that's something that we could make the case to continue. I think one of the biggest things I'm hoping happens right now is that parent voice and parent needs drive system reform. So we have a system that was designed in the 80s and funded in the 80s. And this is how we think about childcare, which is we're funding centers that are open 10 hours a day, 50 weeks a year. And that's expensive. And parents' jobs have changed so much. And in the pandemic, even more. Some people really need the 10 hours a day, 50 weeks a year, childcare center open. And we know that. But we also know that we've seen family childcare shine during the pandemic and be something that was very reliable. Parents had trust, small groups. Actually, the women who work in family childcare, if they are full, make way more money than women who work as a staff person in a childcare center. It's a small business that person is running, but they need supports. Not anyone can just open a small business. So we've added some business supports, which we'll see how that goes, how providers like it. Are they finding it helpful? And providing business supports is something we've done in a small way, but not a big way, whereas we've been supporting accreditation in a big way, supporting quality improvement in a big way. But let's see if you can help programs with their bottom line, can they then improve the program because they can pay their staff more? And, you know, early childhood is the lowest paid industry in the state of Connecticut. It's women's work that comes out of women's work, you know, that you can only pay as much as you can afford to pay and still afford to work, which is what we're seeing in the pandemic. Programs are struggling with enrollment, many of them, because it's not worth it. So the wages are another thing that we have got to address. We are having a worker crisis right now in childcare. If you look at any job board, you know, centers are having a very difficult time recruiting staff. And as the schools have extra dollars and can pay more paraprofessionals, and as Costco's offering $15 an hour and other places are increasing that hourly rates, childcare is really hard work and so important that we have to hope that some federal dollars come in a regular way to support the wages. And we're seeing what happens right now in these stabilization grants. We're requiring programs who take the full amount to dedicate at least 25% to go to payments to staff, additional payments and bonuses. So I think we're going to see the impact of that. But if we're really, I think we can rebuild a little bit to meet family need. You know, if we're going to have paid family medical leave, that's going to help families maybe get, you know, a few months off when you put both parents together, more than a few months off. That may create a little bit of space in the childcare system for the infant toddler shortage. It helps parents with affordability. But let's build a system that's responsive to family needs, which then is responsive to workforce needs, responsive to business needs. Because right now, I have a neighbor who's trying to get 3-day-a-week childcare at a center and is having a hard time because he has to either go full-time or they want 2 days a week. So they're like, well, the minimum's 3 days a week. So he's saying, well, I'd have to pay for a third day, but I can't afford that. So now the child's looking at being tossed between several places. And that's the reality of the current system. But I think we're testing some things out here as parents are telecommuting around how do we make care more flexible. So those are some of the things: parent voice, family child care. Oh, and I didn't say infrastructure. We're going to be assessing the infrastructure needs of childcare and how do we partner with business to try to address those on a regional level. So I'll stop there.
Thank you, Commissioner Bye. That was my next question. How can, well, I'll save it. I want to see if anyone on the floor has a question, but when we come back, if we have time to come back, how can the private sector get involved and how can business and nonprofits best support your work? So Carolyn, Kieran, do we have any questions in the chat? I can't for some reason see the chat fully. Okay. Let's see. No questions yet. Okay, then I will ask, follow through on that question. How can the private sector, businesses become involved, nonprofits become involved to support your work best? I know that you're making some, you have a business council, Commissioner Bye, because we've spoken about it. Commissioner Dorantes, I don't know about your area of the world, but please, on that question.
With the Council on Women and Girls, coupled with the Governor's Workforce Council, we have been working to engage business in these issues in childcare. So we have met twice now with about 5 large corporations who've expressed some interest in helping to lead a business engagement in childcare. And I also know that the Council for Philanthropy is looking for ways to sort of on a regional basis talk to businesses about childcare needs. So the partners we need at the table are families and businesses now. And I think if we can bring everyone together, we'll be more ready in Connecticut if there is a big federal investment, if we can be listening to all of those groups along with the early childhood advocates who've been, thinking about improving the system for a long time. But there's a real place for business leaders in helping us think through financing approaches. For example, we're thinking about financing infrastructure. You know, some big companies might have ideas about that based on how they've structured financing. We know childcare providers are afraid of debt, so they don't want to get into debt. But so what are some ways, forgivable loans, et cetera? But we think the business community can help us there.
The only other piece I would add to that too is part of the workforce development efforts. There is a real attention to lifting people up and out of poverty and really understanding the impact of that benefits cliff, and recognizing that when particularly women kind of going into higher levels of the workforce begin to make too much money to be able to qualify to meet the needs of some of the entitlements that we've been talking about, and really trying to see what it is that we can do on the state side to really eradicate some of those things that are working against particularly female-headed households to kind of get themselves to the place of increasing education, increasing their skill levels while having safe childcare at the same time. And that has been a significant component of the workforce development work as well.
I'm glad you mentioned that, Commissioner Dorantes. If we don't have additional questions, I wanted to ask about that. You all had talked about raising the level currently for eligibility for certain programs to a higher income level, and you just now addressed the this cliff issue. What in your initiatives currently, what other programs or what other efforts exist to address the middle class issue, those who can't afford private child care because they're not at this income level but don't qualify necessarily for programs of support?
I think this is a big gap in the system. Part of it is having more affordable options. Like my neighbors, they can't afford full-time childcare, but they can get a grandmother one day a week, and some other, the mother's a nurse, so she can get one day a week off. So they need 3 days of childcare. That would cost them 60% as much. So I think encouraging flexible arrangements. I can remember in the early days of school readiness, which was Connecticut's attempt at, and we still have great school readiness programs, at addressing this in the 90s. And PCSW and Leslie Brett were really involved in the design of that program. But the implementers at the time, there wasn't an Office of Early Childhood, literally would check the timesheets to make sure that the parents didn't pick up too early and that the kids were getting at least 8 hours a day. Now that's crazy. Like when you think about it, you're saying, so parents were waiting in the parking lot for half an hour before picking up their own children, so the programs could count the child as a full-time child and get paid. Like that's the kind of ridiculous enforcement that goes on. So I think at OEC, we want to encourage, kids need structure and routine. Commissioner Dorantes would be the first to tell you that. But kids can deal with different setups on different days as long as there's consistency. So I think we need to look to build a system that can make it more affordable, again, by not having a 50-hour or 60-hour a week arrangement when 40 will do. So that's one way, but ultimately we need universal childcare. We need federal legislation. Elizabeth Warren's plan is unbelievable. Patty Murray has a plan right now. Either of those plans would make an enormous difference. And things like the child tax credit make a difference in families affording childcare. And all of this lends to the poverty of the childcare provider, because when the parents can't quite pay, but the childcare providers need some income, then they take less than it really costs. And then their whole business model doesn't work. And so I think all these items that address poverty address access to stable care for children.
Thank you. Commissioners, we have one question from the floor, but I know that you had both said you had meetings and needed to hop off at 3:50. Is that still the case?
I have till 4.
Okay.
My calendar tells me what to do, so.
It's your office that we alluded to.
Neither of us could probably tell you what's next till we pick our heads.
Right.
I have until No, I have about 3 more minutes.
Excellent.
About the same.
Thank you. The question is, how will data like in the PCSW's report help the commissioners finance things like infrastructure or to fund programs?
Yeah, I think for us, we have, like I was alluding to, and how you use the information that's gathered to elevate the things that we know are the driving force behind some of the issues that make it more of a likelihood for a child or family to become involved with our system. And so by taking a prevention approach, using this data, it tells us where to point our direction and where to look. I think in Connecticut, we're uniquely positioned because we are so small geographically that, you know, we can target particular areas that might need additional interventions or additional resources. And the data, as you all have broken it out, have given us an opportunity to have a roadmap to really point to some of those areas that might need additional attention.
And I would just say that reports like this, what's going on right now, and the reason childcare is in the news and staying in the news is that there are so many organizations pointing out this incredible challenge that women are facing and the impacts on the economy. But you point out the impacts on women's safety, on income, on their career trajectory. I think the way that you covered a lot of bases makes a really big difference, because you could almost feel the emotional health impact when you read that. Like, this is women's mental health.
Absolutely.
Those pieces together. So, and it's you, and it's NAEYC, and it's CBIA did a survey. You know, all these items are feeding what is a public outcry for universal childcare. I actually think, if I can say it, it's a little bit of a misstep for to spend a lot of energy on universal preschool and separate it from childcare by the Biden administration. Preschool and childcare are really the same thing, as long as it's high quality, it's getting kids ready for school. But the public right now understands the need for universal childcare much more than they understand the need for universal preschool. And so I feel like if all that energy was going into universal childcare, the policy would move faster. Because we need it to move fast. As you said, Tina, these funds are going to run out, and we want to learn from them, and we want to build a structure of a system that supports families, because as well as the families do, that's as well as the kids do.
Absolutely. And I think that in our last minute together, I have to highlight the fact that any opportunity we can to really talk about equity, when there is a universal attention to something, there's less likely to have implicit bias. When you recognize the attention to equity, you lift up where there are inequities or disparate outcomes, that you can focus your attention and resources on those particular areas. And so, as you know, we look to recover from the pandemic, we look to make things better than they were before, as opposed to back to normal, you know, because normal wasn't good for everyone.
That is a great positive note on which we can end, in the sense that this has provided a crisis. There's no question about that, and a crisis that's fallen disproportionately on different groups within our state, but also does present an opportunity for us to do things better, stronger, and more equitable than before. So I would like to conclude by just offering everyone on the call today an opportunity to contact the PCSW. We do have data that we can tailor to the specific type of work you're doing, whether it's geographic work on single mothers, specific work with domestic violence, et cetera. Please don't hesitate to reach out to us as a resource for you. And you can do that by visiting our website. But I would like to conclude by thanking Commissioners Bye and Dorantes for being here with us today. And thank you each for the work that you do. And we hope that we will have an opportunity to see you and work with you again very soon. Thank you, everyone, for being here today.